And I'm going to kick it off. We're going to start with Doug. And Doug is from Washington University in St. Louis. Doug Luke, welcome. So question for you, I know you've been doing this work for a long time and you work a lot with communities. So the question is, how do you translate modeling results and disseminate resources and tools to community partners?
Thanks, Chris. Well, we've already seen some great examples today of this, but thinking specifically about how you take a model and then translate and disseminate those results to community partners, policymakers, it's a really important question. And I really got three things to say. One is I'd like to take an idea from my friend and colleague, Ross Bronson, who's talked for years about the importance of designing for dissemination. And one of his most important points is dissemination is not something that should happen once you're done with everything else. It's something that you plan for and start right away. And I think that's just as true for computational modeling and system science work that we do. The second thing is to remind all of us that there's really several translational challenges or steps when we do this sort of work. The first one we don't even think of as translational, but we translate for a scientific audience. And we spend a tremendous amount of time thinking about, for example, how to convince the epidemiologists or health economists about the validity and reliability and usefulness of these models. For today, I think we want to think about the second translational challenge is how do we take what we've discovered with these models and translate them into data, knowledge, wisdom that can be used by community partners and stakeholders. In our own work, what we found is the kinds of tools and resources that partners need are different than the sorts of things that might naturally come out of an NIH-funded study. And in our experience, some of the characteristics of these sorts of things is tools that are highly visual, resources that, when possible, are tailored. Policymakers in particular are much more likely to be engaged when they see how it's going to affect their community or their funding area or their policy area. And the third thing, if possible, tools that are interactive, dynamic, explorable. We saw some great examples of this, Bruce, of the map of Baltimore and being able to sort of see how people were moving around there. And just to finish up, I think examples are things like dashboards, which allow you to present a lot of information visually and usually are interactive in one sort. Maps, I already mentioned maps, and anything that shows a physical, if the model supports it, the physical area, people really understand maps. Before and after presentations, here's how things look like now, here's how things might look like after an intervention. And in general, resources that allow people to explore what-if scenarios. So essentially, just to wrap it up, I think about disseminating right from the very beginning and have your community partners engaged in dialogue and telling you what they need to support their own decision making.
Terrific. Great, thank you.